Hello and welcome to Heal Podcast. Today I'm interviewing Dr. Robert Turner. So Dr. Turner is a neurologist and a neuroscientist with more than 30 years of experience as a physician. Often patients will go to him for a second opinion, and he also consults with physicians to help them see how to catch things early on. Dr. Turner has numerous trainings in different fields of neuroscience, including EEG and neurophysiology, child and adult neurology, epilepsy, neuromuscular disease, diagnostic medicine, neurodevelopmental medicine, pediatrics, clinical research, biostatistics, and neuroepidemiology. He holds multiple academic, clinical, and research positions, including Associate Professor of Clinical Pediatrics at the Medical University of South Carolina in Charleston, also the Associate Professor of Clinical Pediatrics and Neurology at the University of South Carolina. So we are talking with someone who is very knowledgeable in the field of neuroscience and neurology. When many of us think about healthcare these days, it seems that healthcare is more disease management. Sometimes people are turned away because they're not sick enough, quote unquote, for a treatment to be applied to them. So this is something that did not land well with Dr. Robert Turner. And so what he has done is he actually worked to preventative medicine. When there was markers for potential diseases, he would start working with the patient right away and giving them the necessary tools to be able to prevent disease from happening, or at least catch things early so that we can do something about it. Along with this line of thinking, what Dr. Turner has noticed is that a lot of people are coming to seek help because they have a lot of anxiety, depression, sometimes panic, even seizures. And so what he's noticing is that often there's something in our environments that can be impacting this. And this is what's called electromagnetic fields. So in today's episode, we explore how Dr. Turner got into this field and where his passion comes from. We also hear a lot about his struggle and his story and how he's reached really post-traumatic growth to be able to not only help himself, but help others. We briefly explore addiction, trauma, and ultimately we focus on electromagnetic fields and how we can prevent illness. I hope you enjoy the show. I'm so happy to be sitting here with Dr. Robert Turner, Rusty, aka. How are you doing?
Very well. Thank you, Lucie.
Good. By the way, where does Rusty come from? How did you get that nickname before?
So quickly, grandfather, Robert Williams Turner, dad, Robert Williams Turner. My dad grew up as Bobby his whole life, and he didn't like being called Bobby. Okay. He named me Robert, but when I was born, I had red hair. So when my beard grows, although it's mostly gray now in my late 60s, but it was red. I had red hair. So I was nicknamed Rusty at birth, and that stuck ever since.
Nice. Well, I like that you're still using it. So that's awesome.
Yeah.
So thank you so much for joining us. Today we have such an action-packed conversation. We're going to be talking about trauma, of course, and specifically EEGs, like looking at how can you see trauma on an EEG. But something else, we're also going to be talking about things in our environment that can actually really intensify our symptoms and really cause significant anxiety, depression, impact our sleep. The list goes on. So you've seen a lot of clients in your life. You've seen hundreds of thousands of EEGs. This is a figure that I heard from our dear friend, Mike Cohen.
Probably a little high. I'm upper 60s. So, but a lot of EEGs. And I learned from each one. They're all more different and unique than our thumbprint. I think I put a quote in that I made up some years ago with all honor to Bessel van der Kolk. Body keeps the score. Mm-hmm. Brain tells the story. Mm-hmm. And I think I learned so much from the EEG and the quantitative assessment of the EEG when you put that in the context of evaluating people. I mean, psychiatry and neurology are the two fields, and I'm getting off on my usual tangents, but it's the only fields where we often don't test the organ that we're attempting to treat.
Exactly. Yes.
And if you went to the cardiologist and said, Lucie, you look a little hypertensive. Looks like your cholesterol may be up. We're just going to start you on a statin and a cholesterol. Wait, doctor, don't you want to do some tests first? No, we're fine. We can see it.
Yeah, but they're not looking at it. It's true. And then people are being prescribed, anxiety medication, depression medication, just through the roof. And really, it could be that they don't have that, maybe that's the expression that it might look like, but really inside when we take a look, we see it's really a much different story.
Yes. And that's, again, I like analogies, which I hope are helpful, but it's in a sense, somebody with meningitis and they have a fever, we're going to treat your fever because you're going to feel better when that fever comes down. Well, what caused the fever? And so just it's fundamental healthcare is get to the roots, get to the causes. And I think we're doing that in healthcare, which I affectionately sometimes call disease management, because we're so busy putting out fires and there's more and more fires across all specialties now that there's not time to really truly practice health care like what you are doing and training and implementing, and many people in our field of neuromodulation are truly providing health care, but it's outside the matrix. It's not in what we consider traditional allopathic healthcare.
Yeah.
Okay, great.
What we're doing is neurofeedback, and you're a neurologist. So you're looking at these scans, these EEGs. And so, example, I work with a lot of people who have trauma
Mhm.
and I use neurofeedback. And oh my gosh, what a change this has been doing.
Absolutely.
It's unbelievable. And so it's literally fast tracking a lot of the treatment and then actually getting to layers that, talk therapy just can't get to. So I'm seeing these changes in a really significant way. And so I'm curious, let's say if you were to receive an EEG from a traumatologist, what are things that you're looking for or that you might see as a concern on these EEGs?
From the traditional training, when years ago, 40 years ago, training in EEG, we're trained to look for what's deviations from we call normal. I don't use that term normal. I call it neurotypical based on age, neurodevelopmental or neurotypical. And so we boil that down in neurology. Basically, we're looking for spikes. They indicate seizures, risk for seizures. And I have a different voice, I guess, authority,
That's
or slowing that shouldn't be there based on the EEG. I'm looking at what the whole background looks like, following the trend that for the last several decades, at least, we're seeing more and more slowing of EEGs, particularly even in younger and younger children. Their background, the PDR, posterior dominant rhythm that you've learned about, is slowing down, low and slow. So they're getting slower over time, and not just, you can't blame it on aging, and the amplitudes are getting lower. And so when we were trained in EEG back in the day, the mantra was, when in doubt, call it normal. And so that's what's been done for a long time. Unless it's grossly abnormal, call it normal.
but that's not
And,
it.
well, and I'm not trying to make mountains out of molehills, but often people, particularly with a history of trauma, even if it's not yet recognized what's being manifested in symptoms because of those roots of trauma and other things, they see some healthcare prescriber or provider and a cluster of symptoms, but there's the correlation of the root of trauma really isn't there. And then they get tests and it's like, it's normal. And sometimes either what's said or what we hear is your tests are normal, you're normal, bye-bye,
Mhm.
which fuels more and more of the hopelessness. But from the EEG, abnormalities that are there give us a clue of something going on in their life. And it can be subtle. And I don't do it to try to diagnose somebody with some abnormality. I'm not in the diagnosis and what's important. It's the correlation. And then you bring that through to the symptoms. And then when there is abnormality there, you can, even in the quantitative EEG, you can, as you're experiencing in your practice, you look at that data and you say, okay, this is not normal. This is not neurotypical, but there are ways, this is a clue. It is and I use that line, it is in your head, because people have often been told it's in your head, right?
Yeah.
Which means
It's all in your head. It's
it's
nothing, but
all in
really
your
in
head.
your head, it's something.
It really is.
So I'm just curious because this is a very specific field that you're in here, assessing EEGs. You're working at the Trauma Research Foundation. You're working alongside Bessel van der Kolk. I know that you're at many different places, of course, because you're assessing a lot of different things. But what I'm really curious about is how did you get here?
Being in the field of recovery, I crashed and burned in 1999, went to treatment for opiate addiction, and it saved my life and changed my life. You have to get to the point of being broken enough where you're willing to say, help. And if we can't, hopefully we never quit asking for help because it's important. And that's why you will never be without clients, your patients, the way the world is continuing to develop. It's endless, not even without all the other traumas going around in the Middle East and other places, and people that are trying to center on helping in the trauma issues going on in the Middle East. But it's going on in Toronto. It's going on everywhere.
Yeah.
You know,
Yeah. And I hope, I mean, I know this sounds extreme, but I hope to work myself out of a job in that sense because, I really am so passionate about neurofeedback and I can see like, okay, you're done. You don't need to come see me anymore. Right.
I loved getting rid of patients.
Yeah,
Pretty
exactly.
cool.
And it impacts generations, right? So it's like that's the beautiful thing. It's like if I'm helping one person, I'm really helping them, but their children, they're right, like the whole orbit that's around them, you know?
The ripples go
Exactly.
on and on.
All right. And sticking with our theme, you are someone who looks at somebody holistically. So you're not just looking at the brain waves, although that can tell us so much. You see that presenting concerns are things that happen throughout the whole body. And even as we're going to get to later, from our environment.
It's all connected. That's another phrase I use over and over. Sometimes in neurology, we stop at the foramen magnum, as I say. We just do that. Neurologists look at the brain. Psychiatrists look at the mind. Like it's the same organ system and it's all literally connected throughout our whole bodies. So when I talked about those radiation symptoms, CNS and skin were the first because when we're developing inside, the neuroectodermal system, I loved studying embryology because that tied it all together, which is why there's so many skin manifestations to what's going on. What happens when you're embarrassed? You flush.
Mhm.
All the things that go on that in our skin system that
Mhm.
come from symptoms going on in our brain, in our nervous system. But flushing is autonomic, our autonomic nervous system, nervous, right? So it does all tie in. And again, saying the body keeps the score, but the brain, the EEG tells the story. A really precious friend wrote a book called The Shack. He talks about incremental growth. You have to incrementally feel safer and safer. And as you do that, that's the way healing happens. And
Mhm.
when they start to experience like, oh, wow, I didn't trigger here, or it wasn't the same, or it's like, how's that possible?
Mhm.
But
Yeah. And I also want to turn it back on you for a second because I think you've had that process too and so courageously sharing it. And, we see that you said I had to hit almost, you didn't use this word, but you almost had to hit rock bottom
Mhm.
to sort of develop yourself.
My first experience with chemicals was in elementary school and it was with opiates. It was with cough medicine. Again, that was back a long time ago with a kid his dad was a doctor. He brought cough medicine to school. We went up. I remember this when I was in fourth grade and we took it most people with addiction, we do the things we do because it makes us feel a way that we think we want to feel,
Hmm.
just to feel different, to feel better, to feel whatever. And I remember that use was, whoa, I guess what had been anxiety is that little elementary school kid or whatever. And then I chased that until I was 42 when I finally, did things that thankfully got me caught as a very high performing, accomplished physician and pianist and family person, all that stuff and linguist. And yet when I could admit that I was an addict, it was one of the most freeing things because I went to a place that helped me deal with the roots and get better and stay better. So years ago, I created an acronym. I don't create fancy acronyms that can be copyrighted and make me famous, but MEDS. I don't know if we talked about that. Moving, eating, disconnecting, sleeping. The MEDS. So prescribing meds is the root of physiologic health and ultimately of psychophysiological health. And I think it's one of the big roots for spiritual health as well. When people do meds, it's not, oh, I took my meds, I'm done. No, you keep practicing the moving, eating, disconnecting, sleeping. And then I have a second tier. I call that the spiritual application of the meds, being with mindfulness and spirituality and things that take it even deeper or long lasting.
Is this, did you do the 12-step program as part of? Yeah.
Yeah. Yeah. And the whole history. So I also get to serve as the archivist for South Carolina. I can't say, I don't want to be identified with any organization, but, the recovery, probably one of the most influential recovery movements ever was not, the Washingtonians and all that way back, but was back in the 40s when two people, Bill W. and Bob S., got together through crashing and burning. And that started this whole movement that has helped millions of people throughout the world. That in the whole development of the 12 steps, which are basically 12 principles for life. It applies not to just stopping drinking, stopping using drugs, because that's not the problem. That's just a symptom. It's that people drink or use or smoke or vape or whatever we do or eat or we overeat or abuse because of the way it makes us feel. And then we get trapped and, you can see that in the brain and you can help people get healed.
Yeah. I'm just thinking, because I just finished my doctoral course in addictions. So that's like just now my wheels are turning and I'm like, oh, I could do literally a whole other show on this. But yes,
it's a talk about addiction. And in addition to all my addiction to boards, I went and did all my 10 boards certifications and all my fellowships. And when I was in treatment, I thought it saved my life. And I thought, I want to become an addictionologist too. So I was going to do that. And I was like, I'm glad I didn't. I want to be a person in recovery and keep helping other people in recovery. Because I think that the life of an addiction specialist is rewarding and so hard because many, many people don't get the gift of recovery.
Well, let me ask you this.
Sure.
If you have time here, because, with neurofeedback, we can work with addiction. And I'm curious, did you do alpha theta training on yourself, which is a neurofeedback approach to treat working?
I did some early on. I did infra-slow, infra-low.
Yeah.
Because I spent time, of course, with Siegfried and Sue and Kurt, just such treasured memories. And with Mark Smith. And I did neurofeedback on myself. I had that done as well as part of my whole changing my life and the cycle I'd had for almost 40 years of, eating, overeating, because compulsive eating has been an issue. And so I've been up. I'm the only one in my family under 200 pounds, and I've been up to close to 200. I've lost and gained 40 pounds almost 10 times in my life. And not that weight is the measure, but I've now been able to, not just because of healthy eating, keep it at 150 and below, because that's where I feel good. And I'm still running. I love to do a little bit of competitive running and stuff as an old man, 66. Recovery works, neurofeedback works. So mostly through the years of being pretty compulsive, you want your healthcare, physicians, whoever, you want them to be pretty OCD because you want them to be careful of stuff. And so I did lots of trainings. I overdo things. So I have 10 board certifications and different special, because I wanted to be the best healthcare provider, physician that I could.
Right.
And I contained it in the traditional allopathic, particularly in people with epilepsy. That is one of my specialties, where we don't try to screen like we do for cancer and all kinds of things now. But if we were doing EEGs on a regular basis, we could be screening and saying, you have a precancerous lesion, so to speak. You have a pre-epilepsy finding, or you look at this map of this 3-year-old and there's signs that there's a marker for autism spectrum. Here's what we can do about it to prevent it. But increasingly, it was frustrating because we say 2/3 of people, 75% of people are well controlled on seizure medicines. And it all depends how you define well controlled. That could be 1 seizure to 2 seizures a year. Well, if you have 2 seizures every 6 months or a year, depending where you live, you don't drive. That impacts your life. And we call that seizure freedom, good control.
Right.
And I make the analogy again, if I was a cardiologist, I'd say, well, you're only having about 1 heart attack a year. That's okay. We can accept that.
Yeah.
You
Yeah.
would, what are you thinking?
Yeah.
And so our allopathy approach is anti-seizure medicine. They, in the past, have been called, you'll heard the term anti-epileptic drug, AED.
Mhm.
And that term is finally going away, although people still use it. The medicines aren't anti-epileptic. They don't reverse the epilepsy process. They're basically Tylenol for the fever they're trying to suppress.
Yeah.
But that's what we do 90+% of the time.
And when
First
you
medicine,
say that's what we do, you're saying sort of like this is what traditional medicine looks like.
correct, yes.
Yeah. What you do is actually the opposite. You're going to the root and you're looking at it and doing preventative measures. Whereas what you're saying is in healthcare, you have to wait for it to be, for the person to be more sick before you could do something.
It all started somewhere.
Exactly.
I guess tied in with that, is the word unprovoked. You'll hear that sometimes in healthcare. This was a unprovoked stroke, unprovoked heart attack, particularly unprovoked seizure. Back in the day, without tracking, if you lived in South Carolina like we do, and the hurricane, this was an unprovoked hurricane. Well, we just didn't know it was coming. We didn't have radars and all that stuff. And everything has a source as a start, as you said. And we do think we're getting to causes. And now the big focus is genetic, which is important, but we're not looking at where all those genetic abnormalities are coming from. You wouldn't want your oncologist to wait until the stage 4 cancer is manifest and then come and see me and we'll see if we can help you.
Mhm.
Sometimes that happens because we just didn't detect symptoms, but wouldn't it have been wonderful to get it at stage 1 or something? Get
Yes.
these things before the stroke and so many factors. And so, for example, when somebody has a seizure, they end up in the emergency room or however, they go to the neurologist, they get usually prescribed an anti-seizure medicine, which I'm not anti-medicine. We need those. Those can help. But the same way I said something like a antidepressant can literally be life-saving in somebody's life. If they're on the brink of suicidality, an antidepressant medication can help. If somebody's got 104 fever, bring it down, but deal with the root that caused the 104 fever. And we often don't. It's like, here's your antidepressant. This is the way it is. We'll probably have to go up on the dose, but you're going to be out on the rest of your life. Even though we're talking about the brain, which has more capability to heal and change than really the rest of our body, which has pretty incredible healing capabilities. So
Yeah. Yeah.
I don't know if
And
that
so
got off.
no, that was great. That's great. So, I'm just thinking about where we're going and I'm kind of interested because I would love to hear it from your mouth. When I work with trauma, I know you're a neurologist, but my whole area is traumatology. And so using neurofeedback in trauma, I wonder if you can speak to the neurological changes that are happening in the brain in this population when we use neurofeedback.
Okay. I will try to do that. I might get
Good luck.
off on the tangents, sometimes I say my patients would nickname me Squirrel,
Yes.
from the Pixar movies. But from a trauma standpoint, early on, I had a amazing, she was about 35 at that point and came in mainly with anxiety and sleep issues. And eventually her husband and the 2 kids came, but we were going through, and I had an extensive 5-page history questionnaire that I would go have everybody fill out ahead of time, because that's the more you know, you get the context. And I talk about different types of traumas, but I would word them in different places in the form. Because have you ever had trauma? No.
Yeah.
How do you
And
explain
stop
it?
in another
Or
way.
whatever.
Yeah, exactly.
And we were looking at her eyes open, eyes closed maps. I think that's one of the clues of a trauma marker.
Mhm.
Then when I started looking at the changes and said, sometimes we see this with the history of trauma in the past, and within seconds, as we're talking, she was crying. And she said, do you think that what's going on now may have something to do with the fact that I was raped repeatedly at age 8 by their neighbor, the older neighbor? It's like, okay. And that was one of those, the body keeps the score, the brain tells the story. I just think the brain knows, the brain wants to heal.
So there's a couple of things that I wanted to touch on. So you mentioned that where your interests are going is with a lot of what's called dirty electricity, quote unquote. This is something that you're seeing a lot, is impacts of Wi-Fi and Bluetooth and all of this dirty electricity on the brain. So this impact is something that's pretty significant, I gather.
It has, and that's been going for years. Again, one thing I've tried to say in all spiritual and psychophysiological contexts is that we are electromagnetic beings living in an electromagnetic universe. We all learned about the electromagnetic spectrum in school, right? And everything boils down to frequency and wavelength and energy. That's what the EMF spectrum is about. So where does this all go? And that's how we test the brain. Electroencephalography, electrocardiography, or an ECG, electrocardiogram, magnetic resonance imaging. That's because we're electromagnetic. And one of the things with electricity, and I'm not an electrician, I'm not a physicist, but whenever there's a current, there's a magnetic field. We are electromagnetic beings in an electromagnetic universe world that also, unfortunately, is becoming increasingly electromagnetically polluted. So I make somewhat of a distinction which deals with polarized and non-polarized issues, not politically, but electromagnetically. The fishbowl that we live in is becoming more and more radiation filled. That's just the nature of it. So an electromagnetic field influences a nearby electromagnetic field.
Mm-hmm.
Basic physics, which again, I'm not a physicist, but that makes sense. The same way if two storm systems begin to converge, there's going to be some stuff going on with that. It's just, to me, maybe it's more common sense. And so we are electromagnetic beings. And what's changed, particularly over the last 20 years, is the pervasiveness of it. And this isn't, I don't do conspiracies and all the stuff that people use to sort of discredit Wi-Fi radiation. And we've been told it's safe and it's tested when in fact it's not. 5G, certainly 6G, don't have human testing studies. Recently, the National Toxicology Center stopped all testing on electronic devices because they said they had enough. They knew it was safe, basically. And this is on the National Toxicology website, and and it's too expensive anyway. It's too tough. So don't worry about it. Kind of like they told us about smoking back in the 1930s, 1940s. With scientific, smoking's okay, and it's not only not bad for you, it's good for you. And it wasn't until 1964 that the Surgeon General came out and said, maybe it's good for you, but here we are. So
Yeah, around that time of also 1 bottle of white wine per day for women will help with weight loss. I remember there's an ad like that. But what you're saying, what you're saying here is sort of like, we're electromagnetic beings, and it's almost like we've created our own invisible adversary in a way that's invisible and with us basically everywhere.
Yep.
You got your earpods, you got microwaves, you got, right now, I have internet, and it's impacting our brain waves, right? So it's sort of coming into our sphere, if you will, and impacting the way our brain waves behave, then causing us to have symptoms. And if it's happening over and over and over again, it's creating real neuroplastic change that can then create disease and so on and so forth.
Exactly. If we just talk about radiation, like radiation exposure, it's sort of common knowledge. Well, can radiation cause cancer? Oh, yeah, it can. Can radiation, big word, radiation cause genetic problems? People, yeah, of course but we don't really think what radiation is. And it's that whole spectrum. When I talk about meds, moving, eating, disconnecting, sleeping, disconnecting, here's what the healthcare prescriber says at the end of the visit. Well, make sure you exercise regularly, eat well, don't be on your devices too much, and get good sleep. Boom, boom, boom. I've done my diligence of prescribing healthcare. But with the disconnect, with the electromagnetic world, you can't see it, touch it, taste it, smell it. There are people that have electromagnetic hypersensitivity syndrome, which is a real disorder. But most of the time when people come in with symptoms, we don't recognize the symptoms of what electromagnetic radiation, how it affects us. We understand that in the big scheme. If somebody has radiation therapy, chemotherapy, radiation therapy for some type of cancer, oh, well, it's going to affect their skin. They may lose their hair. They may slough their GI system because it hits rapidly dividing cells while you're trying to kill cancer cells, for example. So there's predictable symptoms, and I have a slide of that, and then I say, what are the documented, when you're dealing with an environmental toxin, or actually it's a fine print thing, but the correct word is toxicant. A toxicant is human created. A toxin is considered in the natural environment, like botulism. A toxicant is something that's human made, the pesticides, all the stuff that's filling our world and our food. And so electromagnetic radiation is a toxicant because we've created, and that's different than our whole electromagnetic sphere that we live in. As I talked about before, there's only 3 things you need to know about what's going on with a particular form in that electromagnetic spectrum. It's wavelength, how much of the waves, and you can have the tsunamis, the big gamma things, the frequency, but with that comes energy. Like gamma radiation penetrates kind of everything, but we're protected in many ways from that, from space, because of the way the world's created. I think in the world of trauma, we can try to feel safe in our sleep environment, which is often filled with things that make us feel safer, which is our devices, our warning systems, our security systems, all of which have electromagnetic properties to them, which can then trigger, you mentioned at the beginning, in an already hyper vigilant, hyper excitable system. What happens is those systems are more susceptible to an outside toxicant. If we're healthy, have physiologic health, the stuff we're resistant to, our bodies are able to fight that. How many cells every day become cancer, but they get detected and destroyed because we have a relatively healthy immune system. If your immune system is down from trauma and all the other things, no wonder we're more susceptible to things.
Yeah, the acronym MEDS is really helpful, I think, because it does show the basics, because this is really what works. This is what we need. And it can create more resilience to the things that we can't see and touch and so forth.
When people implemented neurofeedback, a lot of people that took it seriously and started implementing those MEDS principles couldn't afford, or the Medicaid or whatever, they couldn't get the neurofeedback, or they couldn't do the appointments. A lot of them, they noticed such changes that they got to the point they didn't really need neurofeedback. And so I always say, go wired, not wireless, because the Bluetooth, AirPods, things like that are 24/7 receiving, transmitting. Phones, for example, when they're searching for a network, there's actually more radiation, and that's measured in what's called specific absorption rate, which is on every phone under legal and regulatory settings. Nobody goes there. Every time we update our phone, we agree to the fact that we understand these have specific absorption rate problems, and we shouldn't carry a phone closer than 1 centimeter to our body. And we sign that each time we do those upgrades on our software. And then the other problem is most of our whole bodies are electromagnetic, but our electromagnetic center, without even getting into the whole concept of Chinese medicine and the meridian systems and the chakra systems, which if you bring those up, usually, you kind of lost a lot of the MDs. Oh, here we go. But we use most of our devices along our electromagnetic axis.
So I wonder, and this is me, this is always me, and I never get the answers that I want. I've asked professors, I've asked all these things.
Okay.
What is happening? What is happening to the neuron? What is happening to the circuitry when we are presented with electromagnetic
Toxicants, for example. So my microwave.
My microwave, unfortunately, is right beside my fridge. So I'm around it often, but I try to leave the room when I'm using it, but sometimes I can't. So let's just use that for an example. My microwave is on. What is happening to my brain? What are those waves doing?
Can I share screen for a minute without getting into too many of the slides and show you an image, or would that work?
Yes, that would work.
I can show you something that helps a little bit more with it. Knowing your inquisitiveness, it probably won't be an adequate answer.
Thank you for that nice compliment, but we'll see.
So we have incredible gifts in our world today because of the technology, but it's kind of like nuclear energy. It can empower the world or destroy the world. It's how we use it and how it's been constructed. So that's important. But getting to your question, how does it affect us? We are electromagnetic beings. It's all of our central axis, our head, our spinal cord, our cardiovascular, our gut, and our reproductive system, the urogenital systems, function electromagnetically. It's the nerves, that's how it's all connected and working. And then there's the chemicals, the neurochemistry that is secondary. It's the impulses that release the neurochemistry that keep the electric, it's a beautiful dance of the two. And yet our device use is like that. So your question, what does it look like? So we have wavelength and then we have frequency. And as frequency gets faster and faster, obviously, wavelengths get shorter and shorter. What this doesn't really show is the energy. So the higher the frequency, the shorter the wavelength, the higher the energy, and therefore the higher the penetration. That's why this is like an X-ray in a sense. It's not X-ray, it's called millimeter wave technology, where we get into X-rays because that energy can penetrate. And so, for example, 5G will penetrate, I don't think I have that slide handy, but it penetrates on an average of 5 to 6 centimeters when you're in a 5G environment.
So this goes right through the brain, goes right through the body, creating its own flow, its own wave, like an ocean wave, if you will, in the body, and then sort of impacting our own waves to then change to a frequency that's unknown.
We can see light because we can see the visible spectrum, which is a whole nother problem when you're looking at the part of the visible spectrum as we stare at active light sources, which we didn't do 100 years ago until electric television was invented. Don't go to the light because light's processed in the eye, but it's processed in the brain. That's why screens and other things, why there's, at least in part, so much more anxiety, depression, and all that stuff, apart from social media. But this is great. It shows you what we don't see. It helps the awareness of it. But I'm fine.
Putting it together with what you're saying with your MEDS acronym and looking at how are we building resilience. So you're saying movement, the way that we eat. So we got to eat healthy, of course.
Free.
Disconnecting from our electronics and then sleep. So all of these things are building resilience. Working out, when we're moving, we're building resilience for our mental health, for our cardiovascular health, overall digestion, self-regulation, all of these things. Eating healthy can help us optimize. So when I'm looking at this, one of the major things that I'm looking at is that this is actually part of self-care, is to disconnect and to hardwire versus wireless to help build that resilience to the things that we can't otherwise see. That's
absolutely perfect. And thank you for wording it that way. And again, not as a trauma expert, other than my own personal experiences with that through the years, but often a manifestation, and you're the expert here with trauma. What do we do typically? I mean, we know isolation can be deadly. We hear that more and more. Isolation, the COVID pandemic did not help that.
Yes.
But often when there's trauma, we close in, we isolate. We typically are then outside less. We're not getting light and fresh air. We're not moving.
Mhm.
Our eating habits, typically in a traumatized situation, aren't as good as they could be, let alone the function of our GI system. When it's traumatized, the gut is the biggest influence on the brain. So that's kind of messed up. And then how many people that you see with trauma having sleeping issues, either hard to fall asleep, hard to fall back asleep, too sleepy. I always say people with sleep issues don't have a sleep problem. It's not a problem. They can go to sleep in the middle of the day when they don't want to. So falling asleep, it's doing it when and where we're supposed to. But then the disconnect, what's left is I'm by myself. And so we immerse in, most people don't get a book off the shelf and read, we go on the social media, which we know is toxic.
Mhm.
And that I will put this in here as a quick gap. The Surgeon General published about 6 months ago. I do want to show that to you because that's, as a traumatologist and others, this was published earlier last year by the Surgeon General. It's a 20-page document, easy to read. It's a free download on the Surgeon General's website. We cannot conclude social media is sufficiently safe for children and adolescents and outline immediate steps we can take to mitigate the risk of harm to children and adolescents. And it's not just children and adolescents. And it puts the warning reference to self-harm and suicide. Have you ever seen a client that has had issues with suicidality and self-harm? How common is that now? And if we don't turn it on ourselves, we will turn it out against something else with a mass shooting or some other thing as we work out our trauma. But we go into that very point and immerse ourselves in an electromagnetic environment, which is operating on an already overcharged powder keg, so to speak. And
Yep.
then get back to your question, what does it look like? You can measure the specific absorption rate, and it's listed under legal and regulatory on the phone. How many people go there and read all that stuff? Why you're not supposed to put the phone closer than 9 millimeters to your head and other parts of your body, because this is our electromagnetic axis. Could that be part of the reason 1 in 6 couples are now infertile? Because and it's prenatal. It's what we're exposed to even before we start conceiving children. And then the development, where is the baby carried and where are our devices while we're carrying those babies and things. But you can measure the absorption, the energy of those things. And that's basic physics. That's done all the time in environmental science, from tablets in a pediatric brain, and kids' brains are more susceptible. We know that. And then the laptop. So again, how do we make that electromagnetic axis healthier? What I see as a pediatric provider in neurosciences is the increase in seizures worldwide in younger and younger children. And then when you think about the incredible miracle that's happening during pregnancy and gestation, the most delicate and incredibly intricate miracle is happening in the development of the babies that are immersed in this. It has multiple systemic effects, not all of these in every single person. And it gets into mechanism. When you talked about what does it do in your field, more and more of it comes out in the mental ill health symptoms. And so I say, has anybody seen a client, a patient with dysregulated mood issues, impaired cognition, dysfunctional behaviors, or poor sleep? All in favor, raise your hand. Is Wi-Fi radiation the cause of this? No, it's a multitude of things, but we're missing how this is triggered physiologically. There's mechanisms from what's called electronic screen syndrome. So there's just the blue light effect. There's the environmental Wi-Fi. And of course, then there's the whole toxic social media. And so there's many, many people that can use social media and they do fine. They seem to manage it well. That's okay.
But that speaks again to that whole big picture of resilience. Maybe that's someone who does exercise and have their mental health and
Correct.
maybe they're doing neurofeedback, or, all of the other pieces of the pie may be stronger to help them be more resilient to this. Well, thank you so much, Rusty, for everything today. What a thorough conversation. Is there anything that you wanted to add as like parting words?
I don't know how much we even talked about a lot of the Wi-Fi radiation stuff, because it is, the deeper you look, the more it's like, put me back in the matrix. I can't handle it. It's overwhelming. And yet there's simple steps you can do to be safer along with the med stuff. But if we're not, the one thing of the moving, the eating and the sleeping, there's a lot of kind of awareness of that. The disconnect is there's not as much of the awareness. And so a couple websites I think are wonderful. We have one called Physicians for Safe Technology, which has wonderful resources. One is called Environmental Health Trust, which has tremendous resources of information. One I encourage not just every human, but especially couples and things. It's called babysafeproject.org.
Okay.
Really good. As far as where do we go? How do we start to learn? And it's so simple. The first thing is distance is your friend with any electromagnetic stuff. So I try not to carry stuff on my body. I try to use wired whenever I can. My computer's wired. I want to have resilience to try to stay healthy, because it literally affects every system. It's all of our CNS systems, all of our senses, the immune, the gut, all those things. And like you said, with trauma, we tend to isolate. We may not eat as well. I'm not sleeping as well. So what am I going to do? I'm not going to usually get a book and read it, a nice peaceful book and poetry. We're going to get out our social media and do stuff like that on the blue light, on the screens, with the specific absorption rate that's adding fuel to the fire. And then we wonder why we're not getting better with all the prescriptions that the healthcare prescriber is trying to give us. So,
Which that too can suppress immune, and that's a whole other.
yes.
But yes, oh my goodness. Thank you
Okay.
so much for all of this. I will also put those links in the show notes for those of you who are watching and listening. So do feel free to look at the show notes. And Rusty, I hope to have you back again. Thank you so much for meeting with me today.
Thank you so much for giving me this time
Of course.
and the time together. Thank you, Lucie.
Thank you.
Heal Podcast is an educational platform that aims to depathologize trauma through meaningful conversations. None of the information provided is intended to replace conventional therapy, and all listeners are invited to seek their own professional services for their unique concerns. We are thrilled to have our listeners as part of our growing community. We strive to make our conversations as educational as possible and, of course, interruption-free, which is why we do not include advertisements. So with that, I ask that you please subscribe to Heal Podcast, like and share it with your friends, and of course with your social media to support the growth of this channel. I'd love to stay in touch with you, so come follow me on Instagram at Heal Psychotherapy. You can follow me on YouTube, and you can also come visit us at healpodcast.com, where we do give away lots of free resources. You can get a free ebook, and you can also submit a question for our next guest. Last but not least, I'd like to take a moment to thank Jordan Bernard for creating the music for Heal Podcast. And of course, I'd like to thank you so much for being here. And as always, I'm truly rooting for you.